As the years go by, the body starts to accumulate small changes that often don't get the attention they deserve. Digestion shifts, energy levels drop, inflammation becomes more frequent, and many people end up treating each symptom separately without realizing there's an underlying pattern behind it all. Most men turn to ready-made solutions from the pharmacy, which only mask the symptoms. But there's a simple, accessible, and well-studied resource that can influence key processes like body pH, kidney function, the balance of oral bacteria, and even inflammation regulation. It's baking soda used strategically with intention. In this video, you'll learn how this compound can help relieve 13 common issues for older men and why this real-life use is almost never mentioned at the pharmacy counter. Before we dive into the practical uses, make sure you're subscribed to the channel. We bring you serious and up-to-date guidance for men who want to strengthen their bodies and maintain their health without empty promises, and join the conversation with us. If you've already used baking soda for any health reason, type use in the comments. But if you've never tried it and you're here to learn more, write evaluate. That way we can see who's on the other side and create even more helpful content. The first issue that can be relieved with proper baking soda use is heartburn. That burning sensation in the chest that many describe as something rising from the stomach up to the throat happens when stomach acid crosses the line and climbs up the tube that connects the stomach to the mouth. This is especially common at night or after heavy meals, particularly for men over 50. Baking soda acts in this situation as a neutralizer. When dissolved in water and consumed in small amounts, it temporarily reduces the stomach's acidity. The relief usually comes quickly, within a few minutes, and without the need for manufactured medications. But it's important to stress that this should not become a habit. The body needs to maintain its pH balance for digestion to work properly. In excess, baking soda can interfere with this natural process. That's why it's meant for occasional use, fast-acting, but with care. The second problem that can be managed with the correct use of baking soda is canker. These small lesions that appear inside the mouth, usually on the inside of the cheek or at the base of the tongue, can turn even a simple bite of bread into a painful experience. And it's not just about pain. They also tend to get inflamed and heal slowly if the mouth's environment is too acidic. When dissolved in warm water, baking soda acts as a gentle cleansing solution. It helps rebalance the mouth's pH, creating an environment that's less friendly to bacteria and speeding up the healing of the sore mucosa. The best way to use it is to rinse with this solution twice a day without swallowing. This simple care can reduce discomfort, decrease redness around the sore, and speed up healing without harming the mouth-sensitive tissue. The third problem that can be eased with the careful use of baking soda is pain from arthritis. Especially in inflammatory forms like rheumatoid arthritis, the immune system begins attacking the joints themselves, causing swelling, stiffness, and constant pain. In this context, baking soda doesn't act directly on the joint, but rather on a deeper response, the balance of the immune system. Recent research suggests that small oral doses of baking soda under professional guidance can encourage the body to produce more regulatory cells and fewer inflammatory cells. This shift in the immune profile can help reduce inflammation over time. This effect doesn't replace conventional treatment, but it can offer a supportive boost. Interestingly, this reaction begins in the stomach, where specific sensors detect the baking soda and send signals to the spleen, a key organ in regulating inflammation. A simple step with systemic impact. If what you're looking for is more energy, real muscle, strength, and stable joints to face the effects of aging, the digital book, No More Weakness, might be the missing piece. It's filled with clear, direct, and practical guidance on nutrition, training, and daily strategies designed for men who want to stay active and confident well past 50. You'll find the link in the pinned comment. Grab it while it's still available. The fourth problem that can be relieved with the proper use of baking soda is a gout flare-up. Gout is a type of joint inflammation caused by the buildup of uric acid in the blood. When this acid crystallizes, it settles in the joints, often in the big toe, and causes intense pain, swelling, and redness. In this scenario, baking soda serves as an auxiliary tool because of its ability to change the body's chemical environment. When diluted in water and taken in moderation, it raises the urine's pH, making it easier for the kidneys to flush out. Uric acid. This lowers the blood concentration and reduces the risk of new deposits in the joints. This approach should always be done cautiously and with medical supervision, as managing gout requires a comprehensive strategy covering diet, hydration, and continuous monitoring of uric acid levels. The fifth issue that can be alleviated with the careful use of baking soda is urinary tract infection. This condition causes a burning sensation when urinating, constant urgency, and a heavy feeling in the lower abdomen. In many cases, the bladder's environment becomes too acidic, making it easier for bacteria to multiply and irritate the urinary lining. Baking soda, when diluted in water and taken in small amounts, can help soften this acidity, making the urine's pH less aggressive. This adjustment doesn't replace medical treatment, but it can offer important relief in the early stages. The burning sensation, for example, tends to ease when the urine is less irritating. This effect is temporary and should only be used as a complementary measure. In persistent cases, clinical evaluation is essential, as momentary relief doesn't mean the underlying cause has been resolved. The sixth problem that can be tackled with the external use of baking soda is fungal skin infections. Conditions like athlete's foot between the toes, persistent itching in body, folds, or flaky patches often arise in moist, poorly ventilated areas. Baking soda directly affects these environments by modifying the skin's pH, making it less favourable for fungal growth. A simple solution can be applied as a foot soak or a local compress. Mix a small spoonful of baking soda in warm water and let the affected area soak for a few minutes. The alkalinizing effect helps destabilize fungal membranes, making it harder for them to multiply. This use doesn't sting or dry out the skin excessively as long as it's done carefully. It's a useful option for those seeking natural relief, especially in the early stages of infection. The seventh problem that can be positively influenced by monitored use of baking soda is the progressive loss of kidney function. In certain clinical situations, especially in the early stages of kidney failure, the body begins to accumulate acids in the blood, increasing the burden on the kidneys. Baking soda acts as an alkalinizing agent, helping to reduce this excess acidity in the bloodstream. Clinical studies have shown that in patients under medical supervision, small daily EA doses can slow the progression of kidney dysfunction by easing this chemical stress. Adjusting the internal pH helps preserve the kidney's remaining function and may reduce the need for more aggressive interventions in the future. This use is always done under prescription, as too much baking soda can cause sodium retention, high blood pressure, and other unwanted effects. When properly managed, it can offer an extra layer of protection for the body's filtering systems. The eighth issue that can now be eased with strategic use of baking soda is muscle fatigue after intense exercise. During high-intensity workouts, the body produces lactic acid as a byproduct of effort. As this acid builds up in the muscles, it causes a burning sensation and reduces performance. Baking soda, when carefully consumed before exercise, acts as a chemical buffer. It helps neutralize this excess acidity, extending the time before fatigue sets in. Athletes in various sports already use this technique under supervision, mainly for short, high-demand efforts. The benefit doesn't directly boost strength, but rather improves endurance to effort. However, the dose must be carefully adjusted. Too much can cause digestive discomfort. When used wisely, baking soda provides a real biochemical advantage for those looking to enhance physical performance. The ninth problem that can be relieved with external use of baking soda is the symptoms of the common cold, such as nasal congestion and a sore throat. When the nose gets blocked or the throat becomes inflamed, it can disrupt even sleep. Baking soda helps not by fighting the virus directly, but by reducing inflammation and easing the cleaning of the airways. A gargle made with warm water and a small amount of baking soda can soothe the throat's lining, reduce the scratchy feeling, and help clear built-up mucus. For nasal congestion, baking soda can be added to saline solutions for nasal rinses, helping to break up thick mucus. This action makes breathing easier and supports a more comfortable recovery, especially when the focus is on easing symptoms without relying on sedative medications. The 10th problem that can be addressed with the correct use of baking soda is persistent bad breath, often linked to an imbalance in the mouth's pH. When the mouth becomes too acidic, certain bacteria multiply more easily. These bacteria produce sulfur, compounds that cause unpleasant odors even after brushing. Baking soda, because it's alkaline, helps neutralize this acidity, making it harder for these bacteria to survive. A very effective method is to rinse the mouth with warm water and a pinch of baking soda for about 30 seconds. This simple habit can complement your oral hygiene, improving breath freshness and reducing the white coating that often forms on the tongue. Plus, baking soda doesn't interfere with the beneficial oral bacteria when used in moderation, making it an interesting daily care alternative. The 11th issue that can be alleviated with proper baking soda use is the discomfort caused by mild food poisoning. When the stomach reacts poorly to something you ate, like poorly stored food or irritating combinations, it's common to feel nausea, bloating, and a burning sensation. Baking soda, with its ability to counteract acids, can help neutralize some of the stomach's harsh environment. Diluted in water, it forms a slightly fizzy solution that can relieve this temporary discomfort. This reaction helps release excess gas and reduce stomach pressure, contributing to a better sense of well-being. Though it's a one-off measure that doesn't replace medical evaluation, it can be helpful in mild, short-lived episodes, offering quick relief when the cause is dietary. The 12th problem that can be managed with external use of baking soda is body odor caused by sweat breakdown. Unlike what many think, sweat itself doesn't smell. The bad odor comes from bacteria on the skin that feed on the substances released by sweat glands. Baking soda changes the skin's environment, making it less acidic and less inviting for these bacteria. Applied directly to dry underarms in small amounts, it absorbs moisture and inhibits bacterial growth. You can also mix it with a bit of neutral vegetable oil to make it easier to apply, especially for sensitive skin. This alternative has become popular among those who prefer to avoid industrial deodorants with artificial fragrances or harsh chemicals. Simple, accessible, and functional, baking soda offers a practical solution for daily odor control without harming the skin. The 13th issue that can be influenced by complementary baking soda strategies is the acidic microenvironment surrounding certain altered cells. Ongoing research has observed that the tissue around tumour cells tends to become more acidic than normal, promoting more aggressive behaviour. Baking soda's ability to neutralise this internal acidity has been studied as a potential way to modulate this chemical imbalance. In experimental models, controlled oral administration changed the local pH, reducing the aggressiveness of some cells and improving responses to conventional therapies. This effect isn't a cure or a replacement for any treatment, but it shows potential as an additional biochemical support. It's essential for this type of approach to be guided by specialized teams, as the body's acid-base balance is delicate. Still, scientific interest in this topic keeps growing, especially in areas where pH directly affects cell progression. After everything we've explored in this video, it's clear that baking soda, when used correctly, can be much more than just a kitchen ingredient. It has the potential to address areas that directly impact the well-being of older men, like digestion, inflammation, kidney function, and even physical performance. These are simple applications, but they're based on real bodily mechanisms that often go unnoticed in traditional solutions. Now tell me, have you ever used baking soda to relieve gout symptoms or joint inflammation? Type joint in the comments if you have. If you haven't tried it yet, but are curious about the possibilities, just type curious so we know. And don't forget to give this video a like. It's important because it shows YouTube that this content has value and helps more men access these insights that often don't even come up at the doctor's office. If you want to keep learning natural, safe, and proven strategies to stay strong as you age, check out the other videos on this channel. There's a lot of useful information that can make a difference in your daily routine. And if you're not subscribed yet, take this moment and subscribe now. See you in the next video. Big hug.